It's rodeo day here, and even as COVID-19 cases surge across Alberta, the crowds have arrived.
We will not get sick. This whole COVID thing is a big scandemic.
Hundreds of people showed up today, no masks, no social distancing, no sense that this might be dangerous.
My husband has an autoimmune disease. We've never done masking or anything. And if this was as serious as they say it is, he'd be dead 6 times over, and I would have caught something by now.
Well, you wouldn't know it by looking at this field, but Albertans are supposed to be staying home, limiting contact with other people. There's a public health order that bans outdoor gatherings of more than 10 people, and the pushback to that is more than just this rodeo. Across the province, anti-mask activists marched through the streets.
We're just asking for enforcement of existing health regulations, and we need to crack down on these protesters.
Meanwhile, COVID cases continue to spike. The number of patients in Alberta's ICUs just broke a pandemic record. Pressure on the healthcare system building by the day.
The numbers that we have now are concerning, and we do expect that they will go up.
The spring sitting of the provincial legislature has been suspended for 2 weeks to discourage MLAs' travel and slow the spread. The opposition wants the government to do more.
My message today to the Premier is simple. Show up, come to work, do your job.
Well, that horse may have left the barn. Premier Jason Kenney wants to avoid a lockdown. Instead, he's urged people to follow the rules, including new ones aimed at cooling hotspots this weekend. But clearly, some Albertans just aren't listening. The question now is whether the Premier will do anything more to make them. Aaron Collins, CBC News, near Bowden, Alberta.
Let's bring in Dr. Lenora Saxinger. She joins us from Edmonton tonight. And Dr. Saxinger, as an infectious disease specialist, you're seeing something new in this third wave. Entire families getting COVID. How do you deal with that?
No, I think we really have to reinforce the messaging that if you come home and you have any symptoms at all, you have to really isolate in your own airspace in a separate place in your home. And if you can't do that, you should really be somewhere else apart from your family to protect them. We are seeing whole families getting ill, some of them critically ill, and it's a big concern.
And so part of that's going to be a public policy response, if indeed there is one. And also speaking about public policy, we saw the pictures from Bowden. Is there a way to reach people like that who are disregarding public health messages?
That is just such a tough problem, and I think that the facts are that scolding is not working, that opposing viewpoints conflicting is not working. I would wonder if more consistent messaging from leadership, potentially some restrictions, and also really trying to engage people in the place of information that they have to hand and trying to see if we can find common ground to help protect our communities would be one thing that we can start trying to do.
All right, Dr. Saxinger, thank you.
Thanks.